Hey everyone, Dr. FJ. Want to go through NUCCA. What is NUCCA? NUCCA stands for National Upper Cervical Chiropractic Association. So that's why I call it NUCCA. It's a mouthful. So NUCCA. And NUCCA is what we call in chiropractic an atlas-specific technique that uses the atlas very gently to center the head over the neck. Okay, so it's a whole body adjustment. You're using the atlas, the top bone of the neck, as the lever. So the skull sits on top of the neck, and it is the most important part of good alignment, good posture, okay? If your head is off center, it throws your entire body up. Your shoulders going level, your hips going level. Now all these back muscles will have to fight to hold you up against gravity. These ribs are under extra pressure. One of your legs will carry a heavier load, causing hip, knee, ankle, foot pain. And then you also see a lot of shoulder, arm, wrist, hand pain, numbness, tingling, both in the leg and the arm, all happening because your overall frame is out off center. So like when the frame of your car is out of alignment, the tires wear out faster, they wear out unevenly. Same thing happens when your overall physical frame is off. Certain joints will wear out faster, you'll have more pain, and you hear a lot of people, sometimes they come in, it's like the whole right side of my body is bad. And it's not that it's bad, it's just that you're moving through gravity improperly, so that side of your body is getting killed. It's just getting beat up. Okay, and lots of times if you put two weight scales down, you'll see one side of the body, one leg will carry 20, 30, 40, 50 pounds more weight than the other. Okay? So it throws off your entire body. Now to fix it, what NUCCA does is it applies a very light pressure with the hands to one side of the neck or the other, and either from the front, the back, or straight on, depending on what your x-rays reveal, and you hold it there to slowly and gently center. So it's precision over force, and it's corrective. The proof is in the posture. You see the changes in people's posture, you also see the changes on x-ray. And that's what's so cool about NUCCA and other upper cervical specific techniques like orthospinology, Grostic, is you take x-rays right after the adjustment to make sure you fixed it. So it's a corrective technique, you're actually going to fix it, and then you'll get it to hold. And that's one of the biggest concepts in NUCCA is holding. Holding is healing. Now if you get up and you're back like this, then it doesn't matter. A few days, a few hours, a few weeks, you're going to need another adjustment, the pain's going to be back, and nothing's ever going to really heal. So we have to get you to the point where you're centered and you hold, where you come back in and you're in alignment. We don't have to use the NUCCA technique to adjust you. Then we've added other techniques to help the body uncoil and heal, but by far the most important is NUCCA and getting that body to hold and heal. Okay, so holding is healing, and that's why I switched from regular chiropractic to NUCCA, is because before I just never felt like, I felt like people had to come in every few days, every week, and get an adjustment, or else they would just fall apart again. With this, it's totally different. You're checking them to make sure they're holding, and as your body holds in alignment, all those muscles, joints, and nerves heal. Now you gotta hold and you gotta stay in alignment for weeks and months. So in the beginning, I like to check people regularly to make sure they hold, but eventually you can go months and months and months and you don't need care and you're able to hold your alignment. So NUCCA is very, very different than regular chiropractic. And when you come in, the process of, if they're doing real NUCCA, you're going to have specific x-rays taken. Okay, they're going to analyze those x-rays. You're going to take an x-ray from the side of the neck, from the front, and from the top, and then I also like to take others to see how the whole spine is positioned and where the resistance and the tension is. But you have to have those x-rays to do the NUCCA. Okay, and you're going to have a chair, you're going to have head clamps. I'll turn this around real quickly to show you. Get you right there. So you can see my x-ray chair. Bing. You can see the head clamps on the x-ray. So you sit in the chair over there. Woo, and you have the head clamps. If they don't have head clamps, they don't have a chair, they're not doing NUCCA. Period. And then the analysis you can either do digitally, which I do, or you can do with a pencil on a hard film. That either one is great. Okay? So either one, but you've got to have the x-rays, and then you're going to adjust. So, and that's what the adjustment, a very gentle pressure right here with the hand to the neck, a few grams of pressure. You're going to maybe feel a light pressure on your ear, and that's it. And then you take x-rays after. And you check the legs, you check the posture standing, you can check the muscular tension, scanning palpation, you can do all of that. But you got to have the head clamps, the chair, pre-x-rays, adjustment, post-x-rays, we call them, so before and after, and you go until you get that body as centered and orthogonal as possible. So 90 degrees is the goal, or as close to that. Now the grooves aren't always symmetrical, so everyone's not perfectly 90-90, but we want to get you to your normal so your body's able to heal. Okay, and I used to think, oh, okay, NUCCA gets the head on straight, so what does that have to do with sciatica and back pain? When you understand how the head being off center affects the entire body, how it moves through gravity, okay, then you understand how it can affect the low back. Now the low back, still sometimes I'll go down and adjust a hip, I'll adjust the tailbone to help the body uncoil and heal. But if you don't fix how the body's moving through gravity, and you don't fix how the body's interpreting gravity, if I adjust your hip or your low back, and you have sciatica, and you get up and you go through gravity like this, it may feel better for a little bit, but that problem is coming back. Those tissues are going to continue to get damaged, and eventually it's going to be irreparable. But if I center you in gravity, and then I adjust that hip, now it holds, and it holds for a while, and those soft tissues, those muscles, those nerves are able to heal. Soft tissues typically take around a year to heal. Nerves are also around a year. Muscles heal within around 12 to 16 weeks, about 90 days. Okay, so that's how long your body has to maintain good alignment consistently for those tissues to fully heal. So you want to think of gravity, okay? Are you actually fixing how my body's moving through gravity? And then gateway. Gravity gateway. That's what makes NUCCA so powerful. Gateway is my brain communicates with my heart, my lungs, my liver, the liver, the kidneys, the pancreas, my muscles. Everything has to go through right here. Okay? So the old Superman broke this bone. His lungs shut down, his colon shut down. The heart will keep beating, but it beats faster than it should. It's the only organ that has electrodes in it. Everything else shut down. He had to have a machine breathe from him, a machine remove urine from him, a machine remove poop from him, because this controls everything. So gateway. And when this goes out of alignment, we call that a subluxation in chiropractic, and it causes nervous system interference. There's literally ligaments, dentate ligaments, that pull on the brainstem. You hear a pinched nerve, most of the time it's a stretched nerve or a stretched portion of the spinal cord. Okay, and that can cause everything. And NUCCA got a lot of attention, a lot of fame years ago when Dr. Dickholz did a study, and it showed a NUCCA adjustment could lower blood pressure as much as 2 medications. Okay, lowering blood pressure without any medication. And the way that works is you're centering, you're taking pressure off this spinal cord, improving the gateway. So if you need to get 100 messages through a second, and you're like this, maybe you're getting 50 messages through. But if we get you back in alignment, all 100 get through. So it's kind of like having a rock on a hose or a kink in a hose. Only so much water can get through. That garden starts breaking down. If we unkink the hose, the water gets there, the garden comes back. Now, of course, nutrition, exercise, rest, minimizing stress, all that gives your body a greater recuperative capacity. But if you're not in alignment, I have patients come in all the time. Just had one last night. Oh, I do everything right. I eat well. I take my supplements. I exercise. I rest. I meditate for mental stress. I go, feels terrible. Because all that won't change the fact that your body's out of alignment. Okay, and you can take a med to get rid of the pain, but a chemical will never fix a structural problem. So you've got to fix the structure, the frame. And I have my handy dandy, we'll finish with this. So that is when you're in alignment, you have good health habits. But when that head and neck kink, and the more severe, the longer it's there, and the more pressure, you literally could be living life like that. So if 100 messages a second is full power, then you could be at 5 messages a second. And you could end up with fibromyalgia and all these other issues, migraines, vertigo, poor digestion. Then we get you in alignment, then you start eating healthy and doing these things, and now you have 100% potential, and your body heals itself. Okay? So in studies, NUCCA and other upper cervical specific chiropractic techniques have showed they can help with pain, migraines, dizziness, vertigo, neuropathy, fibromyalgia, sleep problems, trigeminal neuralgia, Bell's palsy, MS, Parkinson's, asthma, allergies, bedwetting, and there's even more, but I had to read those. There's too many for me to memorize. So many things, not because NUCCA fixes those or cures those, no, because it gets that gateway in alignment so the nervous system can function properly. And when your body functions properly, it will heal itself. Why doesn't everyone do this if it's so great? Very difficult to master. It's taken me thousands of hours, tens of thousands of dollars going to seminars and going to masters' offices and spending time with them. So it's very difficult to master. taking me years and years to be able to get great corrections on x-rays. And there's no insurance, doesn't pay any more for it, so it takes longer. So there's other real world issues why I think a lot of people don't do it, but it's an amazing technique. And so if you're having any issues at all, go get checked by a NUCCA or upper cervical specific chiropractor. If you're not sure, message me and we'll find you someone in your area, because it will change your life. The sooner, the better. Okay, so Dr. FJ, remember, health isn't a matter of chance, it's a matter of choice. So choose wisely, my friends.